Good morning from WKYT News. I'm Bill Bryant. We welcome you to Kentucky Newsmakers. Today, more coverage of the rare open 6th District Congressional race here in central Kentucky. Joining us is former State Senator Dr. Ralph Alvarado. The physician from Clark County represented his home area in the state Senate when he won the seat in 2014 by defeating Democratic incumbent R.J. Palmer. Alvarado, the first Hispanic elected to the legislature in Kentucky, spoke at the Republican National Convention in 2016. He was former Governor Matt Bevin's running mate in 2019 when Bevin lost to Andy Beshear. After the pandemic, Alvarado left to become Tennessee's health commissioner, a position he just recently resigned to get into this race. Dr. Ralph Alvarado joining us now. Thanks for coming. We appreciate you coming in.
Thanks for having me, Bill. It's great.
So what is stirring in you that made you decide you wanted to return to politics and return full-time to Kentucky?
Well, I think it's, first of all, Kentucky's home. And so for me, I argue that I've never really left. I mean, we've been commuting the entire time, every other weekend. For me, I've been seeing patients here the entire time. And so this is the place where I've raised my family. It's a place where we've built our home. My medical practice is here. My church family's here. I've served in the state Senate here. So we've been here the entire time is what I tell a lot of folks. But really, ultimately, it's really to help partner with the president. I think it's an opportunity to help work on a lot of his agenda and his vision for the country moving forward. We want to work on things like the economy and kind of fuel up the economy and rev it up. We want to work on securing our border and following immigration laws as well. We also want to talk about, again, he talked about a revolution of common sense in his inaugural address and talking about removing kind of the woke agenda, the social agendas that we are seeing in our government, in our schools, and in businesses. So we want to just get back to the basics and help the president with his vision.
One of your opponents, Deanna Gordon, has already poked at your decision to leave Kentucky for that job in Tennessee and, has said, welcome home sort of thing. Do you expect that to be something that voters will have to process as they consider you for this office?
I don't think so. I think everybody who knows me, they've known my background. They know I'm a Kentuckian. Like I said, I've been here. We've been mowing our yard. We just rolled and baled our hay in our 15 acres we own over in Clark County.
So you kept that?
Yeah, yes. We've been coming back and forth, like I said, the entire time. And when I give my farewell address to the state Senate, I mentioned that we were part of the condition for that previous employment was to continue to come and practice medicine. So every other weekend is what we've been coming back the entire time.
You said you are a major supporter of President Trump's agenda. Are there things that you disagree with him on?
I think he's the most consequential kind of person in politics, I think, in my lifetime is what I think I've seen. Excuse me. And I think he's probably, again, an individual with the vision for this country. I think people are tired of what we've seen happen with government. People have lost trust in government. He's a consequential figure in trying to just having reestablished that and disrupting government from what it's been. Sometimes you look at business people who disrupt a certain sector in business and try to improve that. I think he's approaching it from the same angle. I think a lot of people that are typically in government get nervous with that. But it's been a welcome relief for a lot of people seeing. So I fully support his America First agenda. I think that's also a Kentucky First agenda, and I fully support a lot of his vision. With
the passage of the big beautiful bill, as the president calls it, there are concerns about cuts to Medicaid in Kentucky, which is your area of expertise. Right. A huge percentage of Kentucky's population relies on it, as you know. Do you share those concerns?
Well, I think there's going to be, I think part of it is as a doctor who's been involved in healthcare for a long time, I think we all know the system is broken. We go back to 1980 and take a look at what the costs were then. We are at double the costs in 2020, and the outcomes are about the same. So we really haven't seen a whole lot of improvement or a lot of new ideas. People want to keep pouring water into a bucket that leaks and doesn't really hold it. And so we have to kind of, I think, this is an opportunity for us to look at how Medicaid is designed. It was intended for the poor, intended for the elderly, intended for children, intended for people who are here legally as well. And so I think it's an opportunity for us to reform this. A lot of the cuts that are concerned by our hospitals, you're looking at that for 2028, 2029. So we have some time to look at how that's going to happen, but we've got to find a system that works better for our rural hospital settings. Our rural hospitals are at risk and they're concerned about that. And I've had a chance to talk to a lot of those individuals already. I know they know my work that I've done here in the past, and they're very eager, at least in my campaign, to be able to help with those things.
What would you be willing to do to save rural hospitals? I know there's a $50 billion rural health fund right now that is supposed to help some, but some say that will be a drop in the bucket to keep these rural operations going.
It's got to be available for states that have a rural kind of a rural health plan. And so if you don't have that, it's very important to get that established right out of the gate to make sure you've got that. Those will be the people that will be eligible to apply for that $50 billion, and that'll come in the form of grants. I think part of it also, the system that we have now is just, again, it's been the same old system that we know is no longer working, and I don't think it's sustainable in the long run. I do think there's opportunities. Some states will offer systems that have almost an accountable care organization model, where it's a large block grant model, where the federal government has said, you're spending this much money, and if you can get it down to a certain level, they'll split the savings with you, and then that money can be used for anything that's health related within that state. I think that type of a model will lower the cost for the federal government, give the states a lot more liberty in using those dollars and how they think it should be used. And then I think you can probably, out of those funds, potentially maintain a lot of reimbursements based on quality outcomes, lots of things that you can do to help incentivize good providers and be able to pay for those services.
There are grave concerns that children will fall through the cracks, that there are so many kids that receive their health care because of the K-CHIP program in Kentucky that is federally subsidized. Do you believe that will be the case?
I don't think so. I think we want to protect our kids and make sure that our kids are taken care of. I know Kentucky has always done that, but again, I think there's an opportunity to take a look at. We want to keep the program for those that it was intended for. Kids are part of that group, the elderly, people who are down on their luck, people that are poor. We want to help get people back up on their feet and be able to not have to rely on government as much and be able to go to that. There's things we can do also within a lot of our subsidy programs that'll help people ramp off of that, so you don't have a fiscal cliff where they're more incentivized to stay on government subsidies and not seek things in the private sector. We've got to make that transition easier.
Many in Kentucky's business community were loud when the president started rolling out his tariff strategy. Do you support his goals or what he's doing?
Well, I think if you take a look at the Treasury, I think they've just already reported in the first month $200 billion in increased revenue for that. And I think a lot of his negotiations, he's a businessman who looks at negotiations with other countries. We want to make sure that we have fair trade. I think a lot of people in the world have taken advantage of the United States. We pay higher for certain products, pharmaceuticals, for example, other kinds of products, and they're taking advantage of that. I think the president wants to get us back to where we're on fair standing and make sure that other countries and the United States have fair trade. He's been able to achieve that with certain countries who are willing to do that, and so he continues to have those negotiations. So I think we want to get to the point where we're going to be able to benefit American consumers and make sure that American products have a place in the world.
We were headed down a path toward EV use and mandates, in fact, from the federal government in some cases. Kentucky has a major battery plant that is being constructed and will soon open in the Elizabethtown area. Do you think that it will continue to have green energy will continue to have a future?
Well, I think the free market is what should determine that, right? If people have a desire to buy electric vehicles, and many people do, and they find benefit in that, then I think that's what should drive that. It shouldn't be driven by consumer mandates, or government mandates rather. It should be driven by consumer demand and not by government mandates. And so when the government starts imposing strategies and saying you must buy these things or you can no longer do this, that's where I think a lot of people have a problem with it. And so again, if it's being driven by people's desire to buy electric vehicles or to have those, if there's an infrastructure that's created to be able to support a lot of that, then I think that's where the free market can fill that in. And I think a lot of the manufacturers are seeing some of those demands, and so as long as they can produce those products for those people, I think it's of benefit. But I don't believe that the government should be the one imposing that on consumers.
Because the ultimate goal is to impact climate change. Do you? Is that something that is? You're a doctor, obviously. Yeah. A scientific mind. Do you support continued efforts on climate change?
I think there's always been a fluctuation. If you go back and just look at fossils and records of that and where you find them in the world, I think there's been a fluctuation of those things based on many factors. There's no doubt that we're seeing climate change now. We're seeing changes in rain patterns, flooding. We're seeing things in heat. How much of that's driven by human causes versus just natural causes is still up for debate. But I think we are seeing a lot of that. It is impacting everything from agriculture to health to lots of different things, and we have to adapt as we go.
You mentioned immigration and border crossings are down substantially since President Trump took office. Do you think we need a more clear path to citizenship for folks, so this can be, done in a smoother way, and acknowledge that America does welcome immigrants who enter the country legally?
Sure. My parents were immigrants to this country, and so the key thing is the people that had to go through the proper process don't like to see other people not follow that process, I think, is the important thing. And we've got laws in this country we need to follow. I mean, if you look at the last 4 years with the Biden administration, an absolute disaster in open borders and what it's caused almost a humanitarian crisis in many states and in many communities. Now we're having to clean that up. But we have laws that we need to follow. I think it's important for us to follow immigration laws. But it is also very important that a lot of these individuals also provide a lot of labor for a lot of sectors. I know the agricultural community, construction community, a lot of those are concerned because they need a lot of individuals. I'd like to see an opportunity for work visas and people that, if they want to come in through the proper process, to maybe expand that, to allow workers to come in, work, pay taxes, and then be able to go home when they're done providing the work here. But we do need to have a good, sustained immigration process, and I think the president has a vision for that as well. And that's been an opportunity. When I was a member of his Hispanic Advisory Council, this is one of the topics that was discussed, and he was open to those things. So I'm looking forward to having to be able to partner with him on that vision.
This may emerge as a major issue next year. The Social Security Administration estimates its reserves will drop by 2032 now, to a point that only 80% of the promised benefits can be paid out. How big of a concern is that to you?
Well, I think the president's been clear about protecting Social Security and make sure that it's going to be intact for people that it's been promised to. Now, what that looks like in the future, I mean, again, do you want to keep putting money into a system that it's not sustaining itself? I think there are some who are looking at different potential models, but again, I think the president's been very clear that he wants to protect that, and we're going to continue to protect that for our seniors.
You're up against two sitting state lawmakers. You left office several years ago. How do you reintroduce yourself to voters?
I think people know who I am. I don't know that I have to reintroduce. The fact, once we announced this, I can't tell you how much support we've received from people who are eager to support the campaign. It's been a week, and I've gotten calls from so many folks that are happy to see me involved, asking how they can help, how they can contribute. You have to have somebody who can not only express the needs and kind of follow Andy Barr, who set a great example. Big shoes to fill, but I'm hoping to be able to fill those shoes. But I think people know who I am. The fact that the others are already kind of coming after me, I think, is a sign that they view me as a threat, and I think that people know who I am.
You made that run with Matt Bevin in 2019, and Beshear won the 6th district. Are there fences to mend because of that?
I don't think there's any fences to mend. I mean, we ran for that race. After that race was over, I went to the state senate and continued doing my work there. And I just remind people I'm my own man. I know a lot of people want to link you to other people, but I am Ralph Alvarado. I have my own record, and I'm proud of that record, and people can check that out. I think of the candidates who were involved in this, the one with the biggest proven results. I mean, when we had a divided House and Senate, I was probably the most prolific bill individual that got bills done during that time. When we had a unified House and Senate, the same thing. A person with legislative experience, executive branch experience, the one who's been supportive of the president the longest from 2016 during that national convention speech. I've been with him the entire time for those 10 years, and so proud of that, and I think an individual who can get things accomplished here for our district.
So 44% of the 6th district population is in the Democratic-leaning Lexington. Mm-hmm. Do you think you can hold margins down in Lexington or win Lexington in a race?
I think so. I mean, we've represented half of the landmass in Fayette County during my time in the state senate. So I represented everything in the northern part of the county, Masterson Station, a lot of the horse farms in that area, all along the eastern side of the county, outside of New Circle. I represented all those areas. So Fayette County is familiar with who I am. I've represented a lot of those areas. I feel good about the opportunity to kind of present my views and vision to the people in Fayette County and hope to earn their support.
Give us an idea how you plan to run this campaign. Will you do all of the forums with other candidates? Do you plan to outspend other candidates? Do you plan to, try to sail above the crowd?
Yeah, I think it's all of the above. So really, in terms of, we have a primary to run first. We have to win the primary, and obviously you have to be able to raise funds in this climate anymore. I mean, a lot of people don't like to hear that, but ultimately there's a ground game to go to appeal to voters, be able to go to events, let them know who I am and what I believe in, but also be able to raise the money. I tell people you've got to be able to get your message out, and that those funds that you raise is how you get that accomplished. So that's the first step. And then I think obviously there's an opportunity every chance I get to talk to voters and let them know what we believe in and get our message out. I think it's going to resonate with the people of the district.
Are you excited to be back in the political game?
Yes, it's funny. When my wife and I were discussing this, she asked, do we want to get back to campaigning? I would argue that I've been campaigning the entire time. Campaigning for a cause, perhaps, in public health, and putting in a lot of the miles in driving and doing a lot of that work. But now we're campaigning for an office again. And really fun for me all the things that I've learned, both in the legislature and in an executive branch role, to be able to apply that now for D.C. to support the president and his vision. I'm looking forward to that opportunity.
Appreciate you coming by.
Thank you, Bill. Thank you very much.
Dr. Ralph Alvarado, now Republican candidate for Congress. We'll talk some back to school in just a moment. We'll hear from a regional health leader here on Kentucky Newsmakers when we come right back. Welcome back to Kentucky Newsmakers from WKYT. The school bells will be ringing soon, and parents are starting to scramble to buy supplies and be sure their students are up to date on required vaccines and their health checks. They also may be trying to reset their schedule some, so those early alarm clocks will be a little less difficult to deal with. In recent months, Kentucky has also been dealing with a measles outbreak. Our next guest can get us up to date on those issues. Cassie Prather is the Public Health Director for Woodford County. She holds several degrees, including a master's in public health from EKU. Welcome. Good to see you. Thanks for coming.
Thank you. Thank you for having me.
Appreciate it. School starts soon. What should parents know about what is required of students as they enter a new year?
Well, I think most of that information should be able to find on their district school website, and that really ranges from, what different registrations you have to have, proof of where you live, to proof of vaccines and all kinds of other things. I also want to make sure parents this year are looking at the protocols for, an unknown intruder, someone that is there with a threat to harm the children. These are things that are not, we wish they were not on our radar, but they are, and we want to be able to be prepared, and we want to talk to our kids beforehand so that our kids can know if something happens, who do they look for, what do they do. And also, districts nowadays have many resources for parents, which I find particularly beneficial. I'm also a mother of 5, and so I have familiarized myself with our district's website when it comes to mental health. Mm-hmm. Kids these days, it's a different day, different time. And there are so many resources that the school actually has built into the day, and you no longer have to seek care for things like that outside of the school. Lots of school systems, including Lexington, Fayette, Woodford, have built-in counselors and therapists and things like that. So I know with my kids, sometimes they don't want to talk to me, and I really need to reach out to someone who can either help me as a way to get through to them, or find someone that can.
You have seen in your career the spectrum of public health really broaden, right?
Yes,
to include mental health and safety issues that you were referring to.
Exactly. This has all changed. When I was trained 20 years ago, the FEMA trainings that I had to go through, the incident command system training, emergency health preparedness, those trainings have all changed now. They went from natural disasters to man-made, and so it's all different. As
you work to make sure kids are healthy, are there some things outside of maybe what is required that might just be a good idea to do right as school is starting? Absolutely. I believe in going ahead and getting those alarm clocks, physical and bodily alarm clocks ready. Going ahead and getting those routines down when you're going to be eating supper, when you're going to start getting ready for bed. I've always found that it's good to kind of ease into those kind of things and not just drop that bomb the night, the night before school opens. And so, we try to just kind of get into that groove as easily as possible. That way the system isn't shocked, not ours and not theirs either. And another thing that I think is important, we have 5 kids, and I always talk about them because I've learned more from them than they'll ever learn from me. But we have kids in elementary, middle, and high school. And so I know with lots of kids,
these bus routes change. You have new kids driving. You know, we had the law change last year where we have kids that are driving at a younger age. And so I encourage parents to get out there and drive those routes, because sometimes they change the routes from school to school, or where pickup begins, drop off ends. So I think it's good to familiarize yourself, even if it's a school you've been going to, you know, for several years. They may have had a traffic or safety change that you need to know about beforehand.
Cassie, you think about a lot of things. Do you think that that there are a lot of parents and mothers out there in particular who are going through that same process right now as school is about to start, and they have the same concerns and worries and need a little reassurance?
Yes, absolutely. That is all normal, absolutely normal. And I think that's why, you know, getting out there, even with your kids, showing them where, you know, they're able to get out of the vehicle and where they can jump back in once school is out, or where the buses go. The buses will actually be beginning their routes soon to see where they're going to be stopping. And so if you see buses out, it doesn't mean school's in just yet, but it's almost time, and those bus drivers are learning their routes as well.
Let's talk about the importance of nutrition in lunches and snacks. Some of that provided by the schools in many cases, but in other cases you may be sending something along. What should parents think about there?
Definitely get that breakfast. It's so important, and it's easy to skip in the morning, especially when you're running behind. But I find the more that you can prep and have those things, really grab it and go. You know, apples, bananas, things like that are easy just out the door, that you don't have to make sure that they're held cold or warm. They're ready to eat. And then, you know, our kids always come home very hungry, and so I almost feel like we have a after school dinner and then another dinner. But just making sure that they have things at the ready. They're hungry. They may have sports. Keep things in your car. That makes things easier. Granola bars, things like that. Just try to be prepared as much as you can.
And you would hope that it would be a healthier option.
Exactly.
You're
yes.
mentioning granola bars.
Exactly. I mean, and I'm just as guilty as the next person
Sure.
for, you know, getting fast food. It's very easy, but those prices are going up too. So it may be a little bit easier on the wallet if you plan ahead and get some of those things from the grocery that are better for you and more nutritious.
And keep that nutrition in mind, and as you mentioned earlier, the rest in mind. I mean, these things go along with the ability to learn and the ability to have a good social interactions as well, right?
Absolutely. We are thinking about, you know, the physical and mental and nutrition part of our children, and making sure that the whole child is well, because if kids aren't well, they're not going to be learning. You know, if your child has an abscessed tooth, a cavity that's hurting, they're not going to be ready to learn algebra or, you know, things like that. And so making sure you make and keep those preventative health visits. And one of those visits is your well child visit. A lot of people schedule those over the summer break, and that's where children get caught up on the vaccines, things like that. And unfortunately, we have seen across the nation, but the nation's drop has gone to 93%, and ours is well below that, around 87%.
Well, in that regard, we have this measles outbreak that's attention-getting. Most of us thought that was eradicated 25 years ago.
Yes.
We now have cases across the country and here in Kentucky. You have some update on that, right?
Yes. So at the moment, the outbreak in our community has been contained. The cases that we are seeing in Kentucky and beyond are in kids, adults who are not vaccinated. And so we've got to think about getting caught up and trusting the vaccines that have been scientifically studied for years. And just like you said, in 2020, Measles were declared eliminated, and here we are again having to deal with this. And so it's not even on the radar of our health practitioners. A child comes in with flu-like symptoms, which is how measles can start. They're not thinking to test for measles. And so we've got to get this back on our radar, and we've got to make sure that we have the vaccines that are safe and effective.
We're seeing some uptick in COVID right now, right? You're getting some reports.
Yes, getting some reports in our ED data and things like that, our hospital and medical visit data, that is trending upward a little bit. Hopefully that will start to go back in the other direction before school starts.
From your perspective, are we turning the corner on substance abuse here in Kentucky? We've seen some encouraging reports about a drop in overdose deaths.
Yes, and I think that is largely due to Narcan being readily available. So many ways that you can get Narcan, and it's free. So the fact that it is accessible and available has made a huge difference in saving the lives of our loved ones.
And just a lot of awareness out there these days. Yeah,
yes.
More than that. We appreciate you. Thanks for over the years being so accessible to us when we've needed to, but most of the time we've done that remotely, so appreciate you coming in today.
Thank you for having me. I just want to remind folks to make sure when they're packing their lunches, their school bags, to pack patience for that first day of school. It's always, very stressful on everyone, and patience, kindness goes a long way.
Well said. Cassie Prather, thanks for coming. We appreciate it. Thank you.
Thank you.
Everybody, we'll wrap up Kentucky Newsmakers in just a moment. Stay with us here on WKYT. Before we go, a little heads up on where we're headed with next week's program. State Auditor Allison Ball will join us. She's recently done that statewide Kentucky Department of Education audit. And EKU President David McFadden will talk about the school year ahead and other issues. We thank you for joining us for this edition of Kentucky Newsmakers. Have a good week ahead.